Hello again, this is Dr. Lenz, and welcome to Module 5. One of my most favorite modules for this course. I know it's the first time that you may have heard some of this information, so it gets me very excited to talk to you about it. And for some of you, maybe you've been exposed to this before, but today we're going to address the issues that really determine someone's health. So in the last module, we talked about our healthcare system, and in a very high level view in all of its complexity. But today we're going to address what makes someone healthy. You can think about it in your own context, in your own life, and the folks that you live with, and your loved ones and friends and family. But this data that I'm going to present to you is really from a larger social, societal environment, population level data. Just to give you some perspective of where we are. And it's going to tie directly into the assignment for this module, which I am really excited to see how this comes out for you for this. So what I'm going to present to you really are three different publications on what is called the determinants of health. And sometimes it's globally called the social determinants of health, but essentially it's that is only a component of what determines folks' health, the social side. So just if you ever read social determinants of health, sometimes people inaccurately write about that if they're not familiar with how to use the term. But anyway, so in any case, the determinants of health essentially are made up of about 5 different primary factors. This is what most people report on for this. And to be fair, and as you know, I think it's good for you to know that there's been a lot of reports about what determines health and the percentages of these factors that go into determining health, and they're all varying. And one thing to keep in mind when we look at this data is that what would determine someone's health in your hometown or in your house, for that matter, is going to probably be different than what it is in a different part of the world, different part of the country, maybe different part of the state, maybe a different part of the country. If we look at Omaha in general, I think the determinants of health would be different if you looked at folks who lived in West Omaha versus East Omaha because of the socioeconomic differences there. So that's one important piece to keep in mind about this. One of the first reports on this was published in 1980, and it was actually published by the Department of Health and Human Services, which is fantastic to get out of the gate on this. And by the way, the reference for these I have attached for you, so you can refer to this paper that was published in the Health Affairs Journal. So this is where I aggregately came up with these charts from the table that was published in that reference paper for you. So what they talk about in here is that someone's behaviors, personal health behaviors, make up about 50% of what determines health. The social piece, social circumstances, they did not address in this. It's addressed in the other two that I'm going to show you, but it's not addressed in here, and that's why it doesn't show up on the chart. Environment affects about 20%, meaning the environment that we live in. So environment could be, do you have safe sidewalk or a safe neighborhood to live in? Do you have sidewalks? The place that you work, or do you have access to food? Or is it just fast food and convenience stores that you have access for food? So that's environment encompasses a great deal. Of course, personal health behaviors, if we go back just a second to that one, that would be whether you smoke, and of course the easy ones to think of is exercise and eating right, but it also includes any other personal behaviors that might affect health, like your engagement in violence, engagement in risky sexual behaviors, that type of thing. Then we move to, as far as the Department of Health and Human Services, genetics, as they say, is about 20% of what affects an individual's health. And then 10% is the medical care that we receive. really the point of today, and expanding from where we were last week and last module, is to look at the relative significance of our medical care, our healthcare system, and how much that actually affects or determines an individual's health. So this is the healthcare system that we all know and engage with. It is our health sciences programs that we train all of our health sciences professionals to care for folks in this way. And interestingly, even back in the 1980s, it said that the medical care component only determines about 10% of health. Fast forward to early 2000, this particular study was done by McGinnis and colleagues, published in Health Affairs also. It lists all 5 of the determinants on here. It says the personal health behaviors are about 40% of what determines health. The social circumstances is about 15%, and so what that would be is the social environment in which people live. This is a very broad context. You can think about it in a social as granular as the environment, not the social context of the home that you live in, or how you were brought up, and the social norms that exist within a household. You can broaden that out into the social, cultural norms for a workplace or a school place, if you want to think of it as the age differences there, younger and older. You can think about it within the community, within the country. And certainly it's different at all phases, but enormously complex is this social circumstance, because it is the culture in which we grow. So we know that when we grow up, that just take something simple as, do you eat your fruits and vegetables? Do you, what was that like when you sat at the dinner table with your family? Did you even sit at the dinner table? That's another part of this too. But so take one about, do you need to clean your plate and have no food left on it before you can leave the dinner table? That is something that would fall in the category of social circumstance, because it's a culture. And on the very granular level, take something as in the neighborhood or part of the city that you would live in. What is the social norms and acceptances of physical activity, or the types of food that you eat, or the violence or that is there? What about attitudes on taking care of yourself? As far as if you have a chronic disease, do you address it? What about taking medications? What about going to even see somebody when you're sick? One of the pieces too that's very important to remember here, underneath the social circumstances part, lies all the economic factors also. So do you have enough money to even pay for food that is fresh, even if you have exposure to it? Do you have money to pay for health care? That type of thing. So then environment for this report is 5%. Genetics makes up a large chunk at 30%, and still medical care still at 10%, according to this report. Fast forward about a decade later, some folks from University of Wisconsin published this report also, and so this addresses just 4 out of the 5. They don't address genetics in here, but personal health behavior is about 30%, 40% social and economic, 10% under the environment, and then 20% for medical care. And so again, I think one thing to keep in mind is, regardless of the exact percentage, because my opinion, wherever you measure this, regardless of how many people you're measuring, it could be different in Omaha, Nebraska compared to in London, England. Certainly in Omaha versus Dallas, Texas, or maybe someplace in the southeast, or someplace in the northwest. These numbers will change based on the population that you're measuring. But I think the thing to keep in mind for today is relatively speaking, they're in the same ballpark. What that means is majority of what makes up our health, or what determines our health, is in our personal health behaviors and in social and economic. Certainly genetics plays a role in there too, but if you want to talk about things that not that you cannot modify gene expression, because we can, have been shown in some ways to do that, but largely our greatest impact, I think you could make this argument, is that it would be in personal health behaviors and in the social and economic side of things. So what that means is the biomedical model that we all know only makes up a small percentage regardless of whose data you're looking at. And that's something incredibly important for us to realize as a medical community, as a healthcare consumer community, because we all engage in the healthcare system. So are we getting what we should be getting from our healthcare system? That's something that's going to affect our own health. I would make a strong argument for ramping up, meaning more money, more time, more resources in the personal health behavior side and in the social and economic side. What that means is a shift in our focus of the biomedical side of things into the social side, and a heavier emphasis on social sciences background for the healthcare community, healthcare workforce community. And just a little bit of trivia for you, and I'm not sure if I've mentioned this before, but in the mid-1950s, Centers for Disease Control, I think I mentioned this already, but it's worth saying again. The CDC started collecting data on what the population looked like as far as percentages with certain conditions, and so the incidence of diabetes in the United States was less than 1% in the 1950s, and you fast forward that all the way to 2050, and the same group, the CDC, is predicting that greater than 1/3 of the United States population is going to have diabetes. And again, thinking about what has taken place already from the mid-1950s to today, and then what will take place from today forward to 2050 regarding our advances in science and technology, our understanding of disease, and our development of medicines, all in that biomedical context, is not making a difference for this condition, which is largely preventable, the type 2 diabetes side of things. So I think you can make a strong argument based on something like that type of data with this type of data to show that we really should be shifting our thinking and looking at healthcare not as transactional, meaning I'm going to engage with the healthcare system as a patient, and they're going to give me something back, and then I go away. Like pharmacy, I give them a prescription, they fill it, they give me the medicine, and I go away. Not to say there aren't some great models of people doing personal care, but it's a model of transactional care versus personal care that I think the social sciences could really help with that piece of it. And I think it's that personal care side of things that we're missing in our system to address the factors that really determine our health. So anyway, so that's just to give you some perspective of where we are. So I hope that you can tie this with the last module on our healthcare system and what we know about it, and then it gives you some perspective on what we're doing with this degree, the Healthy Lifestyle Management degree, and that it is all about relational care, being part of the team. And I'm not saying at all that any of the biomedical components aren't necessary, because they absolutely are necessary in so many ways. What I'm saying is we're missing a critical piece, and that's where we're coming in with this healthy lifestyle management program and degree, and that it provides that relational care with the individual you're working with, i.e. the patient or client or participant, whatever you want to call them, but also within the team of healthcare professionals. That relational care within that team is also very important. And so that hopefully this person who has these skill sets that we're trying to develop within the program will be the one that has a high emotional intelligence and recognize what are the factors that are determining this individual's health in front of us, and so that we can put the pieces in place to help maximize their health and start creating health, so then they can have that high level of well-being and really thrive in the environment in which they live and work and play and spend their time. So there you have it. If you have any questions on this, certainly let me know. I look forward to the assignment this week. It's going to be fantastic as it relates to this here. So if you have any questions, just let me know. And in the reference here I've included along with your slides so that you can read it and get this information for yourself if you wish. So until we meet again, take care and have a good one. Thanks.